Dr. Sutton is full of information today, and he's answered a couple of questions here. One in particular interest to parents here, Dr. Sutton. One, my child swallowed a marble. Should I be concerned? Of course, kids swallow all kinds of things.
Very true. And parents often bring their children into the emergency room because they don't know what's an emergency and what's not. Okay. Oftentimes, a marble is quite safe. I have to usually reassure parents that it's okay. It's not recommended.
How is that safe?
It's safe because it's not going to cause obstruction or a blockage, and it's likely going to be passed through the child naturally. Yeah. I wouldn't recommend it a part of the diet.
Don't eat it, though. Okay, gotcha.
There are some things that I do get up out of my seat for, though, and I get concerned about. And that includes things like kids swallowing magnets, button batteries, and sharp objects. Okay. If it's any of those, then it needs usually a clinical evaluation and sometimes an intervention to get that object out.
Okay, an intervention. I mean, how serious is that going to end up being? Some kind of a surgery? Or you need to still going to have to pass that in some way?
So great point. So it depends on what the object is. Okay. Sometimes we use certain types of endoscopic procedures where we use a camera and move the object down lower past its site of blockage, or sometimes it has to be surgically removed.
All right, another question here. What's your best advice for treating a headache? Sounds like the simplest thing, but we don't seem to be able to get rid of headaches sometimes.
It really is. It sometimes can start simple with basic medications like Tylenol or non-steroidal anti-inflammatory drugs like ibuprofen or Motrin. But my main goal when I'm talking to a patient about their headache is figuring out what type of headache they have. It can be the regular everyday headache. It can be a migraine, which we know is one-sided throbbing, sometimes associated with visual changes and nausea, vomiting. But it can also be other types of headaches, like cluster headaches or tension headaches. Cluster headaches can happen localized around one eye and cause a lot of pain and sometimes swelling and eye irritation. And the treatments for each of these headaches is different. So I think the first goal is figuring out what type of headache you have and then treating it beyond that.
All right, but sometimes the over-the-counter won't do. Sometimes you need to head to the hospital and talk to somebody. All right.
Unfortunately.
Dr. Sutton, we appreciate you as always. Folks, keep your questions coming to the good doctor on his Instagram at dr.darien.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.